So this is Miranda Palto with Mav Media at James Madison. This is 20 Minutes with a Pro, and today we're here with Cass Villarreal, who works as a registered nurse. So, would you please tell us a little bit about yourself and your job?
Yes, my name is Cassandra Villarreal, and I am a registered nurse at St. Joe's Children's Hospital. My degree is a Bachelor's in Science and Nursing, and I also did an additional 2 years of cardiac imaging. So that's actually what I do now. So my job is to evaluate the babies whenever they're born for any type of congenital heart defect or a heart defect that they are born with. I also go into the cath lab with them during interventional procedures, and we go into the CVOR with them whenever they have open heart procedures done.
Oh, so what does a typical day at the hospital you work at look at for you?
The great thing about my job is I don't have a typical day. Every day is totally different. So that is one of the things that drew me to doing congenital heart disease. Not every child's heart is the same, especially whenever you're talking about children that are born with congenital heart defects. So they could be just as small as functional holes in their heart where they can go the rest of their lives and lead a normal life. To some children are born with what we consider single ventricle defects, which means they're only born with half a heart. So at that time, there's some defects where we have to go to the cath lab right away. There's some defects where we have to go to surgery right away to do open heart procedures on them. There are some kids that we feed and grow until we do these procedures on them. So every single day is totally different. We also run a sickle cell anemia clinic. So we monitor children that are sickle cell, that either have sickle cell trait or sickle cell anemia, and we follow them to make sure that there's not any adverse effects on their hearts. We also do a lot of monitoring of children in oncology that are receiving toxic chemotherapies. And we monitor their hearts during their treatments to make sure that the chemotherapies that they're receiving are not detrimental to their health.
So what exactly is sickle cell anemia, and how does that affect them?
So sickle cell anemia is whenever your good blood cells in your body see your own body or your own blood cells as enemies, and they attack each other. It's typically in either African American population. It's a higher African American population, and also some Hispanic populations.
How long does it take for you guys to figure that out? Is it right when they're born, or does it take a little bit of time for y'all to notice those things?
Typically, the parents know. So most of the time, if both of the parents are sickle cell, then their child will be sickle cell, or if one parent has sickle cell anemia, then sometimes the children can be sickle cell trait, which means they're just a carrier. So that's actually through hematology. They figure all that out. Cardiology just follows to make sure that their heart is fine.
Oh, okay. So how long have you been in the healthcare profession overall?
I've been in peds cardiology for this February will be 21 years. And then I was a floor nurse before that in the adult cardiac unit for, I think, almost 9 years before that.
So what motivates you to do this job, or how long you've been with it?
The kids. I think that I enjoy being with the kids more than the adults. And I'm inspired by their strength. You would be amazed at how quickly these kids recover. And I also, enjoy the surgery aspect of it. You see these kids very, very sick, and then you can walk into the clinic one day, because that's another part of my job that is different, is I get to work in the outpatient clinic. So we get a lot of closure from that. I get to see these kids grow up and, walking and learning to read, and then later on coming in, with their girlfriends or boyfriends, coming in with their wives, and then coming in with their own children. So I get to see them through their whole aspect of their life.
Wow. So you actually get to follow up on them. Like it's not just they leave and then you never know what happens. You get to see them.
Correct. Yeah, a lot of, if you do bedside nursing in the critical care area, you see these kids out on death's door and you get to see them discharged, but then you don't get to see them afterwards, where we get to actually see them in the clinic setting. And it's really nice to be able to see these kids, grow and just like normal other kids.
So does anyone else in your family work in the healthcare industry? Like any other positions or hospitals or anything like that?
Well, my niece Maddie is going into, she's going to be a physician's assistant or nurse practitioner. I don't think she's decided which road she's going, but she will be in the medical field also. I have 2 uncles that are physicians on my side of the family, and that's pretty much about it. Everybody kind of steered clear of the medical field.
Did any of your uncles push you towards doing this job, or was it kind of what you've always wanted to do?
What I've always wanted to do. I originally went into pre-med into college thinking that I wanted to be a physician, and then just didn't want to commit the years. I wanted to be able to get out and start working in the industry.
So what made you realize that this is the work you really wanted to do, and when did you start realizing that for yourself?
You know what, like I said, I think I was always drawn to the medical field, and I was always drawn to, caring for people, and I just enjoyed that part of it. I think that what drew me towards the kids is, like I said, working for great surgeons and seeing all of the wonderful work and seeing these kids be very, very ill. But then whenever we put them through our plan, their plan of care, then they come out on the other end so healthy and living normal lives like other children.
So what type of specific schooling did you go through, or did you have to do multiple types of schooling to get where you are now?
So I did multiple. I went straight from high school and right into University of South Florida, and did my nursing degree there, and then did 2 years of cardiac imaging afterwards. So the cardiac imaging part of it was basically doing an internship at the hospital. So a pediatric cardiologist, I followed them for 2 years and basically learned the job directly from them.
So what degree did you say you earned for this?
My bachelor's of science in nursing, and then the cardiac imaging is more of a certificate. It's it's through ARDMS, and it's the American Registry of Diagnostic Imaging, and in congenital heart defects, specifically.
So would you mind walking us through some of the positions you had before this that kind of helped you to get where you are?
Let's see, whenever I first got out of school, when I first got out of school, went into peds oncology. So peds oncology is, childhood cancer. I did that for a few years. I worked in the adult ER, and then I worked for a cosmetic surgeon for a little while. And I really thought that I was going to enjoy that, but I didn't really feel like I got a lot out of that. And then I went back to adult cardiology and started doing post-op adult open heart patients, after surgery. And then that's whenever I found out about the cardiac imaging residency that they had at the hospital. And that's whenever I applied for that and got into that. And then 2 years later, I ended up in peds.
Oh, wow. So having the ability to be in those positions kind of helped you lean more towards being able to help children rather than adults?
I think that with adults, I felt like, I don't know, I felt like it was all kind of the same, issues. Everybody has coronary artery disease, or, they have, they were lifetime smokers, and that's what led to their heart disease. It was more like wear and tear on the heart. So I felt like once you kind of learned that, then you kind of learned everything about the adult heart, because it started out a normal heart, and then just, through the years, things happen to it. So it was more of acquired disease than it was a congenital disease. So the kids that were born, I mean, it's almost kind of like a treasure hunt. Sometimes these kids are born in the middle of the night. Mom may or may not have had prenatal care. And so you go in and you image these hearts, and you have to put the pieces of the puzzle together to make a diagnosis. And so that's what I always thought was fascinating about that part.
Do you have any interesting stories that have kind of stuck with you through your time doing this?
Oh God, over 21 years, I'd take all day. I think that, I think what's the most interesting part of our job is, finding out the intricate details about harvesting hearts and being put on lifelink and heart transplant. So we don't do transplants at our hospital, but we transfer our transplant patients to University of Florida up in Gainesville. So I think that, learning all of the social aspects of kids being put on the list for transplants was very interesting to me. Like, they have to have a good social background. Like, they have to have responsible parents, because you're going to be put on medication in order to take care of this heart. You have to, put other parts of their pathology into consideration too, because you don't want to, harm anything else. Like, you don't want to give a child a heart that could have gone to somebody else that would have benefited them more than giving them to somebody that has like multi-system issues. So I found that really interesting. I thought, God, who has to make this decision? That's got to be a very difficult decision for someone. And luckily I don't have to do that. But I thought that's really neat. I got into that whenever we started harvesting hearts from our patients to the list. And I thought, a really tragic situation comes this really beautiful thing of donating organs. So I think that's, those are things that you don't think about donating your child's organs. You think of whenever you're old and you don't need them anyway, so you're going to go ahead and give them up. But it's very difficult, for parents to make that decision.
And are there some children that you end up following to that path? Like, once they do pass, do you usually want to see what happens, like, after that?
Yes. Once they are declared and their parents have decided to donate the organs, then we do, they go to our OR with a team of surgeons, and whatever organs that are going to be used, that team of surgeons, they all meet together and they all do it at one time.
If a student wanted to get in your line of work, what elements from public education would you want them to focus on, such as history, math, science, English?
Let's see. I think that definitely math and science I use on a daily basis. History, as far as the school aspect goes of it, I don't know if I really use it that much. But history for us, we do, because we come out with new surgeries and then we decide, oh, that doesn't work out, and then we don't use them anymore, and then we learn from that history. In English, I have to type up reports, and you have to sound, somewhat intelligent whenever you do that. So I say that definitely English. So I think that if I had to eliminate one of them, it would be history, but everything else you use on a daily basis.
So what specific types of math do you use, or that you've had to take in college and other things like that?
I took all the basics in college that everybody else would take, your chemistries and statistics and stuff like that. And then I also had to take pharmaceutical math. So that's measuring all of your medications. And then we also do, in the cardiac imaging part, we have to, all of our imaging machines will do all of our calculations for us, but we also have to know how to do them by hand in case that part of our software goes down.
So what would you advise a student at our age to start doing to get where you are now?
I would say if you can do dual enrollment, I would say definitely do that and start getting some of your college classes under your belt, so that way you're not you don't feel like you're spending too much time in college. I think that it's also financially beneficial to you to do dual enrollment. That would be my main thing. And also, find out what you really want to do and then go to school instead of changing, your aspirations and your track in the middle of it. Sometimes that could be a little frustrating for you and for everyone else,
So what are one or two things that you really enjoy doing in your line of work?
Like I said, the kids. I think that the kids are what I really enjoy being around. I think that you can't be in a bad mood around kids, especially babies, and it's just, a lot of fun having them around. And then also the people that I work with. I think I work with a bunch of very, very intelligent people that I learn from every day. Even though I've been there 21 years, there's not one day that I don't walk away from there and say, I've learned absolutely nothing today. I'm always learning something new, whether it be, professionally linked or, just on a personal level, just learning.
So what specific characteristics do you look for in those coworkers?
So that's a very important question. I'm myself and one of my coworkers are very involved in all of our hiring processes, especially in our department. We have a relatively small department because it is so specialized. I look for personalities, to be honest with you. I look to make sure somebody really wants to work and wants to be part of this and always is interested in learning something new. I can teach anyone who really wants to learn. If you have the drive to learn and you're eager and this is something that you're interested in, I think I could teach anyone to do that. But you can't teach somebody to have great work ethic and be able to get along well with others and take corrective criticism, because man, we get a lot of corrective criticism at work with the physicians and stuff. So you have to learn how to just kind of not take things personal and use everything as a learning experience and move on.
So I know you mentioned you worked with not as many people in your work life, but how many people do you think you interact with outside of that, like in the hospital?
Oh geez. The hospital that I work at has 4,000 employees, so I could be working with any of them at any time. Most of them, of course, work on the adult side. They don't work in the children's hospital, but that doesn't mean that I wouldn't interact with them.
So when working with so many people, do you think communication skills with them are important to have?
Absolutely, hands down. Communication is like key, especially in a field where the information that you're communicating is very important.
So what's one of the most surprising things that people don't really understand about the healthcare industry that they don't really think about?
I think that a lot of people, I don't know, I think that a lot of people understand the medical field. They understand that it's difficult and they understand that it's heartbreaking. I think that maybe what they don't understand is the type of person that gets into the field absolutely has to love their job, because why would you want to, go day to day watching people be ill if you didn't love it, if you didn't love caring for them and making sure that you do a good job, and making sure that you make your patient feel important and that you really care about, their outcome.
So through all of the years working in the healthcare industry, has there ever been a time that you felt you really went above and beyond in your position?
I could say yes, but I think that whenever you go, over and beyond, I feel like that's just part of the job. I feel like whenever you're not going above and beyond, you're not giving 100%.
So I know obviously you love your job, but is there anything that you would ever want to do as a job, maybe when you retire from this, or any jobs you've ever thought about before that you want to do?
I think if I ever did, I always joke around with my friends about, having my dream job at Starbucks, because I love Starbucks. I of course couldn't probably work there, but I don't know. I think if I were gonna do anything else, it'd probably be like a veterinarian because I love animals too. So I think I would like to do that, but I would probably do large animal, like take care of horses and like farm animals and stuff like that instead of, because I don't know if I could really get into like ferrets and rodents and stuff like that. I would have to go more like, bring me your horse or your cow or your llama. I don't know.
Well, those are all the questions I have, but do you have anything you would like to share with the students that are going to be watching this? Like any information or just any insight onto the industry you work in?
No, just decide what you want to do and go for it. You know, set your dreams and your aspirations really high and just go for it.
Well, thank you so much for your time, Cassandra. And that's all I have for today. So thank you so much.
Thank you, Miranda. You guys have a great day.